second. And colleagues, can you help me and just give me a thumbs up when you see us going live? Okay, perfect. And if you're here from Arizona, I'm also going to go live on the Arizona Educators United page. Just give me one more second. Okay. And let me come on back. Oh, that's right. I put you guys down here, didn't I? All right. Okay. Thumbs up. Those of you who are my colleagues on here, do you see us live on NEU? And Arizona people, do you see me there?
We are live on NEU.
Perfect. Let me just double check Arizona. I know there's people that wanted to see this. All right, 1 second, please. All right, perfect. All right, so welcome everyone. We will get started here. We do have a slide deck. So we know this information is really, really intensive and hard to decipher if you haven't been studying it for like a month or two, like a few of me and my colleagues have been doing. And so we wanted to give you the opportunity to make a copy of the slide deck so that you can have it readily at your fingertips. You can use it with your colleagues or parents or communities or whoever. And so here is the link. So go ahead and open. It's a Google slide deck. So if you're not familiar, you can just make a copy by going file and hit make a copy. And I will pull that up in just a second and we'll get started. All right. All right, so this is our understanding indoor air quality in public schools, which is an incredibly important topic. My name is Rebecca Gorelli. I'm a 17-year science educator, also an organizer with Arizona Educators United and also with National Educators United. And I'd like to introduce my co-presenter. Melissa, please come on in.
Hi, everybody. I am Melissa Tomlinson. I am an organizer with National Educators United as well. I'm also with NJ21 United and Badass Teachers Association.
Yes, thank you. And so Melissa and I are going to be your co-presenters just for the majority of the material, but we do have a very special guest. His name is Allen. Allen, just give everybody a hey and we'll introduce you formally later. But it's really just going to be the three of us now. And we do have our colleagues with us helping us drop links, monitor the chat and that sort of thing. So again, thank you all for being here. And if you could help us out, there are a lot of educators across the nation who really would love to have this information. If you are in an advocacy group, an Educator United group, a caucus, or a community group, go to our page, National Educators United, which is a Facebook page. You just search for it. It's public, so you'll find it. Join our group. Colleagues, if you guys can watch and monitor the approvals for people to come into our page, we would love for people to share this widely. So we're going to do a do now activity where everybody does this right now. So I'm going to give a couple minutes for us to share this as widely as possible. And I'm going to kind of look at our page and I see that we are, let's see. And we are asking that you share this live video. All right, let's see how many people we got sharing. Wow, 88 shares already. That's pretty incredible. So thank you. I think there's some people on Facebook as well. Hello, Facebook community. Thank you for sharing. All right. All right, so let's move along. And if you are still kind of working on getting in the Facebook group, that's okay. Just keep doing that and please keep sharing. The more information we can get across the nation on this one issue, the better. And so how this is going to work, it's just going to be a basic webinar where just keep muted as we go on. Use the chat box for any questions. And really just make sure it's turned on to everyone. And then after Allen, our industrial hygienist, speaks, we will have time for question and answer. We're going to use a strategy called stack to kind of virtually stack people in line so we can call on you and honor your voice. So this is going to be very information intensive. As you go, if you have questions, jot them down, keep them for the Q&A time. It is going to be packed with information. And so let's just get to know each other. Let's see who's with us, who's on Zoom, who's on Facebook. So wherever you're watching this, just write your name in the chat box or on, the comments on Facebook, and what's your name, what's your role, and where are you coming from? Just take a minute. All right, and colleagues, can you please make sure that the link is on view only, the one that we are widely sharing out? You can go ahead, you all have access, so you can change the settings if I forgot to do that. I thought I did it, but I could have made a mistake. All right, so we have New Jersey, California, Arizona, lots of folks coming in from different places, Texas even, fantastic. Hopefully we have some Philly people on here. I know Philly reached out, said they wanted to join. All right, and so if we can get a visual, if you're on a PC, this is kind of a fun way to see who's with us. If you're on a PC, not like a phone or an iPad, you can use your Zoom toolbar at the top, and basically you go to the button that says annotate. So if you click the annotate button and then you click on the button that says stamp, and you can pick one of these shapes and you can tell us where you are actually coming from. So that's where I'm at. And it's kind of a fun way to see who's with us. I see New Jersey. And so again, it's in your Zoom toolbar. You should find annotate, stamp, and then pick a shape. So we got California, a few Arizonas, Pennsylvania, nice. Maryland. And we'll just give everyone a minute. There's some folks still coming in. Whoops. All right, Kentucky. And if you don't have that button, that's okay. And we'll just give it a minute, let everybody get acquainted. Ooh, we have Honolulu, fantastic. Welcome. All right, I'm gonna clear the drawings. So if you're just figuring it out, hopefully I didn't cut you off. But that's just kind of a fun way for us to see who's with us. And so I'm going to clear all the drawings and then we're going to move on. Just make sure you turned off your annotate tool. So again, this is nationwide. National Educators United, we're a group of organizers that build educational materials, organizing materials. So if you're looking for where we house our materials, it's on our website, and this presentation will be in this folder by the end of today. So just to let you know, there's our website, and you just go to committees and resources, and it'll go right into this folder. Oh, some more folks are coming. All right, so I'm going to invite you to just read over the agenda really quickly. And our goal is first and foremost to give you the knowledge and the confidence to actually talk about this issue in your local, in your area. And then we'll provide a couple organizing strategies that some of us have used to organize around this issue. And so we're going to start by just taking a poll of who's with us. And the first question is in regards to where are you at in your district? Are you full remote? Are you a hybrid or modified, A/B schedules, reduced class size, or full in person? And then there's a second question in regards to ventilation. So I'm going to launch the poll. And if you're in the Zoom meeting, please take the poll. All right, we're at 61% of people voted. We're almost there. I'll give it about 20 more seconds. All right, answers are slowing down. And this is a little bit different than the last time we did this presentation. So this is interesting. We're at 76% voted. The numbers are still going up though, so just give it another few seconds. All right, people are still taking it. All right, in 10 seconds, I'm going to close out the poll. So if you just joined us, we're at about 82% of folks who voted that are on here. So I will end the poll and I will share the results. So it looks like at this point, most folks are remote. And this is actually pretty shocking. Last time we did this, there was a lot of more no's about ventilation and talking about HVAC and indoor air quality. So I'm actually pleasantly surprised by this. So it kind of looks a little 50-50. So hopefully tonight you learn some information that you can bring back, and let's get that yes all the way up to 100 if we can. This is an issue we all should be talking about. All right, so thanks for taking the poll. There's the second question. We did that. And so really, right now, a lot of us might be remote, or like me, I've chosen to have my student or my own children remote. I have 3 tiny kids. And at some point, we're all going to return to in person. And so we really need to be thinking about what measures do we want in place when we are back in full in person. And the second question we're going to dive into tonight is how do we actually organize? How do we organize our workplaces, our school sites, our districts in order to demand a safe reopening in regards to indoor air quality? And so right now, I'm sure a ton of you have read your district documents on, what kind of protocols they're going to be put in place. And so it's a mixture across the nation of these things. We have masks and face coverings. The troubling part is this next piece: social distancing when feasible, when possible. I mean, raise your hand if you're on here. How many times have you heard your district say, well, when it's possible or when feasible, over and over again? And now we're seeing some districts saying, well, we're going to work for 6 feet, but really it might be 3 feet, and trying to hide behind the CDC sort of saying, well, they say 3 or 6. And an increased use of sanitizer, when sanitizer is really what comes after you wash your hands. And so that's troubling. And then I've also seen in my own kids' district reduce class sizes when possible. Yet as a parent, I've had to say, I want my kids to come back when it's safe, but wasn't told what safe meant until a very short time ago. And so this whole idea about when possible, when feasible is really concerning. And I want you to think from this list, what is missing? What's missing is HEPA filtration units, talking about MERV filters, talking about the HVAC, fresh air, having classrooms outside, actually doing things that are going to make a difference. And so I'm going to pass it over to Melissa for this video.
So thanks, Rebecca. This is a video that shows you the different types of masks and what happens in terms of contamination from somebody breathing out. And you'll see as the video starts playing, you'll see the lighter color. That's where what would be potential COVID micro droplets that would be spread through the air.
Oops. Sorry.
That's okay. So this is the first mask. You'll notice it has the nose piece. It's tight on the sides, but you're still seeing behind a person. And that's something that came up as a big concern in New Jersey because we had districts trying to do front to back only 3 feet, thinking that behind was not going to be as much of a transmission area. You can see the real light spots all around the chin. So that's all potential contamination that's gathering around a person. So something you want to be sure of, like when you're going home, is you make sure you wash that area so that if you have caught something, that you're not like spreading it into whatever. This one's a little bit better. It's tighter around the sides. Got a bigger, stronger nose piece, it looks like, and it is less going around the head space. But there is still some coming up here. So what we're seeing is that masks are not 100% effective. And we know this, right? We know that there's different types of masks and which masks are going to be better for indoor space. Again, you see even less, but you can see it kind of growing up on this area of the head where all those lighter spots are.
All right. Sorry about the sound. Yes. Thank you. Thanks for helping out. And so let's think about this mask thing for a second before we move on, if we could. Oops, wrong button. And so when you think of kids going into school with these masks, I want you to think about what kind of masks they have and how many of those masks have those gaping holes on the side where this stuff, and if you're standing behind them, that's just going to literally be COVID in your face, right? Let's think about that for a second. And then what we wanted to talk about next is this article that came out a little while ago that really talks about where 6 feet actually came from. And back in 1897, there was a bacteriologist, sorry, hard word, named Carl Flug, who basically studied infectious diseases, and he came to the conclusion that 6 foot is a logical distance based on droplets that are visible. So we are all operating under this 6 foot rule, which is a good start, right? But in the case of COVID, we're talking about COVID as an aerosolized airborne transmitted virus, particles that are so small you cannot see them. And we are operating on antiquated science. These are for visible droplets that he could see and that he could measure. And he saw the trajectory come down and where they dropped. And he measured it for the different diseases. Honestly, he went through a whole kind of research study. And if you want to learn more about it, it's linked in this document right here. And inside this document, in this article, is also this chart, which I thought was very, very interesting. And it talks, let's look at this for a minute. And I want you to think about a school. And we have low occupancy here, high occupancy here. And then we have different scenarios. We have wearing face coverings for a short amount of time, wearing face coverings for a prolonged time, no face coverings short, no face coverings long. So let's think about school. And when we have all of these children, and in Arizona, we have the highest class sizes in the nation. I had 34 kids in my class a year ago, and I worked in a portable and I wasn't allowed to open the door. So really, when you think of fresh air and we think of, okay, they might have a mask on, that's great. But if we're there for 7 hours a day and eating in our classrooms with taking mask off, which makes no sense whatsoever, look at this chart. We have silent, speaking, shouting, singing. And then I want you to look at the ventilation. And I'm in Arizona, and what I know about Arizona is we either don't have windows or the windows that do exist don't open, and we're not allowed to open doors because of active shooter protocols. So the idea of getting fresh air in from the outside is not going to happen through a window or through a door. And it's not like they're going to take away the safety protocols for active shooters because we've asked. And so when you think about it, I want you to grab your annotate tool and think of your current situation. And I want you to stamp where you think your current situation is on this chart. And for example, I think of my own children going to school, poorly ventilated Arizona classroom. I've seen their room. It has no windows and no door that opens to the outside world. So if I send my students to a poorly ventilated, high classroom volume, high class size, we are in the red zone. So take a minute. If you are here, annotate your situation on this chart. Grab a stamper, dive in, and let's collect some anecdotal data. So we have some folks who actually have low occupancy and well ventilated. I'm curious to know where you guys are. And the risk of transmission is these colors. Red is high, yellow is medium, green is low. And so this is a really good document to kind of have some conversations with people at your school site about, you guys, have you really thought about these different scenarios and where are we on this chart? If you're wondering how to organize with people, having some information to talk about and describe a tangible object is a really great way to like start a conversation and see where people are at. And so we wanted to just bring this out. I'm going to clear the drawings. Thank you for those who participated. Yvonne, that's a super cool. I see your large arrow. Thank you for that. And now we're just going to move on, and I'm going to pass it back to Melissa to talk about Hygiene Theater.
Thanks, Rebecca. So New Jersey has opened up a large percentage of the schools, whether it be for hybrid or full-time in-person learning, all students all the time. And we've come across some situations already when it comes to conversation around cleaning. So we added some materials to this presentation. If you had joined us the first time, a lot of this stuff is new things that we're talking about because we've come to the realization that, you know, the districts are doing a good job of surface cleaning and really putting forward a show to try and show us how they're cleaning, and they're going around and doing the doorknobs every couple times a day, and they might be spraying with disinfectant in the bathrooms or something like that. But when it comes down to it, it's all hygiene theater. Now, that's not to say that surface cleaning isn't important, and we're going to tell you some details about that. But at the end of the day, it's this aerosol transmission that is not really being mitigated, and that's what we're going to talk about. Allen's going to talk a lot about that. So in terms of cleaning, on the next slide, Rebecca. There's three main types of cleaners that you'll hear people talking about. And there's a lot of details about this, and I just kind of took an overview of everything, but I do have more information included in this. But there's the cleaner that people use to remove dirt, germs, etc. from surface areas. And that's, with a cloth and with, oh my gosh, my mind just went blank on the words, but it's like rubbing the dirt off, right? Then there's sanitizer that removes bacteria on surface areas, which is less effective than a disinfectant. And a disinfectant is what's used the most to remove all the infection germs on surfaces and can include viruses as well. But disinfectants are often misused or overused. They have to be combined with water, and that needs to be done at a specific dilution or a concentration level. So the directions have to be followed exactly for them to be effective. The amount of surface time and the amount of chemical on the surface is important, right? The surface needs to be glistening wet, and the dwell time, the time that it's allowed to sit on the surface before being wiped up, is important as well. And then there's also concern that every time they're used, antimicrobial resistance likely increases. So there's the potential that a disinfectant may no longer be as effective in an area if it's used over and over and over again. And one thing that we've come up in New Jersey recently, seeing in a lot of districts, is that the labels and the data sheets and the trainings protocols are not being followed according to the law. So all these chemicals must be registered with the EPA, and you are supposed to get right to know training on the use of all these chemicals. And you'll see in that right to know training that the people handling these chemicals are supposed to be provided even stronger PPE than you might have as a classroom teacher, or if you're using it as a teacher, which I would not suggest, you should be provided glasses or goggles and gloves as well at a minimum for a lot of them. And then you'll also hear a lot about the foggers and the misters, and they kind of look like, I call them Ghostbuster backpacks, right? So we have a custodian in my school that walks around to common areas after there's a group of students in that area with this backpack on, and he does like this misting in the room. And that's based on the direction of the spray. It relies on gravity. Sometimes the coverage is uneven if it's not done very well. And again, the resistance can increase. And a lot of these chemicals, unfortunately, although they might be approved, they are still health hazards and dangers that are associated with them. So we're putting ourselves into potentially harmful situations. At the same time, we're trying to remove ourselves from a harmful situation. So we're getting caught in the middle here of, is it safer to be exposed to these chemicals, or is it safer to be exposed to COVID, when the real answer is that perhaps we shouldn't be in school buildings at all? And this is just a little information about the EPA. There's a couple links in there. All the chemicals must be registered. It tells you how to find that chemical on the EPA registration site. We actually had to do this in my district because the district had switched out a chemical and didn't inform us, and we didn't have the right data sheet. This pharaohsproject.net tells you a lot more kind of the potential hazards of chemicals above and beyond what the EPA has approved. And then all this information that I've gotten, there's a lot more information that was put together by some bigger experts. And I provided that file that was shared with me as well. And we're trying to get that information passed around. I do want to make one thing, put something in people's minds. So in New Jersey, we have PIOSH, which is our Public Employees Occupational Safety and Health. Now, not all states have that for public employees. We're very lucky in New Jersey that we do. And we've already started filing complaints against a lot of this chemical-based stuff. We just had one district that reported back to us today that PH was in the district and they are following up with the complaints. And if, the district has a certain amount of time to comply, and if they don't comply, they're cited. So this is as you're going back into buildings, which potentially, you will at some point in time, this is something to keep in mind to continue to work for the healthy work environment that you deserve. So next is Allen, and I'm very, very proud to say that Allen is also from New Jersey. He was introduced to me through Heather Sorgi, who is the head of the Healthy Schools Now Coalition, which is a campaign that's been very instrumental in our pushback in New Jersey, and it's part of our Work Environment Council in New Jersey. But he's an industrial hygienist for the Work Environment Council, and he's been helping us with health and safety issues for the past 4 years. He was a previous art teacher in Bloomfield, and also has Institute of Technology Master of Science in the Architecture program. He's written a book about olfactory perception and studied under the Hunter College Industrial Hygiene program. Also involved with the National Education Association. And just like I said, Allen has been one of our go-to people along with Heather. And, without them, we would be in a lot worse situation than we are. So I'm going to turn this over to Allen now.
Thanks, Melissa. Okay, so I'm glad that you started talking about disinfection first. Excuse the noise in the background. I'm glad you started talking about disinfection first. We are going to get to that, and I have a slide that kind of compares surface transmission as a risk to aerosol transmission, which is what we'll be talking about today. So why don't we get started? We could go to the next slide, Rebecca. Thank you. Okay, so first I just want to say thanks for having me here again. This is our second time doing this, and I'm really glad to be able to reach so many folks about this, especially seeing that only half of us are having these conversations in our buildings, and especially considering what happened a couple weeks ago with the CDC kind of recognizing aerosol transmission as a risk for a few days and then kind of taking that back. Hopefully more and more folks are going to start paying more attention to this. So I start with this initial slide to give you an idea of what the public building stock looks like for the most part across the country. Maybe not in your district, but these are some buildings from New Jersey. One of those I worked in for 11 years. It's in Bloomfield. The building's 100 years old. It's more than 100 years old now. So you're in these pictures you're looking at, the top picture is an illustration right around the time that the camera was invented. And then at the bottom is a picture of those buildings still in use today. Just to give you an idea of how old some of these buildings are. And that's important in this context that we're going to go into in just a minute, because mechanical ventilation systems were not invented in 1900 when some of these buildings were put up, and that is what causes some of the problem for what we're dealing with across the country in terms of an aerosol virus. So we can go on to the next slide then. So let's start with the basics here. How do we get exposed to this virus, and how do we determine the risk that's associated with that exposure? So there's two main ways that the virus is transmitted, but we could think of them both as originating in our mouths. As we breathe or speak, even, we release droplets into the air. Those of us that are teachers are familiar with this. As we talk to a large group of people and project our voice, these droplets, we can see them coming out of our mouths. But there's also well, those are the bigger droplets, right? They fall to the ground. We were talking about that before, usually within 6 feet. A lot of times they're visible. These are the kind of droplets that accumulate on surfaces. And that's why we need to clean surfaces like floors, for example, because those particles could land on the surface and then be resuspended as people walk through the building. Again, we'll talk about the relative risk of surface transmission in a moment, but that's why surface transmission is an issue to begin with, is because these droplets are coming out of our mouth and they're landing on desks and floors, not just the things that we touch. So these are the larger droplets. These are impeded by masking. So even with a loose fitting cloth face covering, these types of coverings are considered a form of source control. So they don't protect you from others, but they stop the droplets from projecting and accumulating on surfaces. So that's something that we know, and we know that works. Masking works to help impede some of these, a lot of these larger droplets. The other droplets are more problematic. They're not really even droplets. I don't know if you'd want to consider them as drops. They're so small that they're called aerosols, and they have that name because even though they're not a gas, they're a particle. They're so small that they behave like a gas. And this is like the video that we just saw. So they can escape face coverings get more easily. They can accumulate over time. So that's something we didn't see in the video necessarily. We saw it escaping, but what we don't see is what happens over time in a room that's not ventilated. Those gaseous like aerosols, they accumulate so that the dose becomes higher over time. So that if you were to walk into a room that's poorly ventilated, that's had somebody breathing in it for a long time, you're way more at risk than if the place was ventilated, because those viral particles are not concentrating. So the thing is, how long does it take to be exposed? What is the dose and how long does it take? Thing is, we don't know that yet. We still don't know what the dose is that's required for someone to be infected. That's making this really difficult for us to measure the risk. So what we do know is that risk equals intensity times duration. This is like the chart that already came up, that good ventilation, bad ventilation. The intensity is speaking, singing. Those are two different intensities, and that's what we're talking about here. Or if you're a nurse or somebody who has to do intubation for a student during the day, that's a totally different intensity. Or if you were a phys ed teacher, for example, and students are constantly engaged in high respiratory activities, that's much more intense. The general guidance that I have here on the slide is 15 minutes within 6 feet should be the limit, but that's without using source control like face coverings, for example. So just to give a real ballpark figure there to start the conversation about what is my risk. Just remember, intensity times duration, 15 minutes, 6 feet. All right. Oh, sorry. We can go to the next slide. Thanks. I'm used to giving these presentations and having to take care of the controls myself. Well, speaking of controls here, so we're looking at an image that's called the hierarchy of controls. And this comes from NIOSH. You recognize the last few letters from OSHA. So that should be a little more familiar. So this inverted pyramid is a framework for protecting workers and all building occupants from recognized hazards. So I would ask you to notice that, first of all, PPE is at the bottom of this pyramid. It is considered a control method of last resort. And it's something that you should do after you've done all the other things. And the reason for that is because it relies on many things in order to work, one of those being human behavior, which is really hard to manage and to guarantee cooperation. Sometimes even under situations where you don't even intend to, take your mask off, for example, but something happens and you end up taking the mask off. That because of that variability and that unreliability, PPE is put at the bottom of the hierarchy of controls. Okay. It's just not as reliable as the ones that are further up at the top. So at the top is elimination of the hazard. So in regards to infection control, that means keeping infected people out of the building. And that requires a substantial testing and tracing capacity, which on a national level, we still, to this day, these are the same words I had a few weeks ago, we're still lacking. We're getting much closer now, but we're still lacking the testing and tracing capacity that we need to keep as many infected people out of the building as we can. There is a rapid test that I think is already being distributed, which will hopefully change this a lot. We wish that that happened, 3 to 5 months ago, but it is happening now. And so that should change that issue and allow us to eliminate the hazard in the first place. That's at the top of the pyramid. And that is a really important control. And it's worth all the masks combined. All, the PPE is at the bottom of the pyramid. If we could just keep infected people out of the building, that would be the best control. So somewhere in the middle of that pyramid, though, and in the meantime, because we don't have rapid testing, we don't have the contact tracing capacity that we want, we have to rely more heavily on engineering controls. You see them in the middle there. It's actually with the yellow behind it, so it's hard to see the white font, but that says engineering controls. And that means like machines, like ventilation, mechanical ventilation. So maximizing the introduction of outdoor air for ventilating the building, that's an engineering control. There's also administrative controls for staffing concerns, for example, like if too many people call out, or how to staff people appropriately to not overlap and have the building be over capacity. These kind of staffing issues and administrative controls, where I have to mention the value of union membership, because union membership affords rights to workers that are very beneficial in this context, because union members will be more likely to have access to sick days, for example, so that they can stay out in the first place and not have to go to work because they can't miss a day of work, because then they'll miss money and they won't get the paycheck at the end of the week. That goes against the #1 control of keeping infected people out of the building. So again, this goes back to putting things in context. Where are we going to get the most bang for our buck in terms of how we're going to try to prevent transmission of this virus? Let's go on to the next slide here, because this is a control method that folks are very familiar with. I think we're too familiar with it. I want to take a minute to talk about cleaning and disinfecting. I might just refer to it as cleaning, but they're two very separate things. This has become the most visible of our efforts to control the virus. Masking is also luckily becoming more and more visible nationally. But unfortunately, the thing is, this is not the most effective way to control the virus, and has led to what many are calling hygiene theater. So we've already started to talk about this. I want to reinforce the idea of the relative risk of surface transmission by pointing out this bottom right corner of the slide there. There's a quote from the CDC. They put out an update in May. This is a very long time ago, where they said that it's not thought to be the main way that the virus spreads. Instead, person to person is how they describe the primary means of transmission. And the more recent update that was posted on September 18th on a Friday after hours talked about aerosol transmission as being a primary means. And that's what we're talking about here. These aerosol gases, kind of bottom line is surface transmission is not as much of a risk. Now, cleaning is important. We have to do it. Disinfecting is necessary in some cases, but we have to rely on all the controls that are available. And we can't expect just one of them. You ask your district, are you doing, what we need to keep us safe? And they say yes, and they show you all these cleaning products and all these disinfecting procedures. That's not it. There's all other controls that we need to keep in mind as well. Another thing is cleaning and disinfecting are not the same thing. Disinfecting uses powerful chemicals that can create unintended adverse reactions, and over repeated exposure can lead to its own health risks. So even if you don't have an acute reaction to something like an asthma attack as you walk in, which is still possible, and we've already got calls of this happening, there could be something that happens and you don't realize it's happening because it's repeated. It's happening over and over again every day. That can have its own adverse effects on exacerbation of asthma or autoimmune issues that can pop up from repeated exposure. So there's also some concerning patterns of staff using disinfectants and children using disinfectants. So if you're not, and I want to point out here, if you're not on the cleaning staff, you probably shouldn't be cleaning. First of all, it might be a contractual problem, but more importantly, and this falls under OSHA laws, you must be trained on how to use cleaning and disinfecting products, because you could be exposed in the process to hazardous materials, and you have the right to know what those hazards are and how to keep yourself safe from them, and your employer is obligated to protect you from them. You're just supposed to be going to work. You're not supposed to be going to work and risking your health or worse. So keep in mind that there are certain obligations that as an employee your employer has, and they're required to do. But a reminder that children can't use disinfectants. They're pesticides. All disinfectants are pesticides, and they're registered as such with the EPA. And if you look carefully enough on the label of any disinfectant, it says somewhere on there that children should not use, or children must not use. So kids should not be using this in class. A kid or not, if they're 18, if they're your student, they really shouldn't be using these products. And if you must, final thing about this, if you must apply disinfectant, which in some cases we do, try to look for the safer versions. Yes, it might be on the EPA list N, and it works against COVID, SARS-CoV-2, but we're collateral damage for all disinfecting products. Okay, and there's another list called the Design for Environment list from the EPA that has about 7 chemicals that the name of the product might be different, and the way the chemical looks might be different on the SDS sheet, but there's like 7 basic chemicals that they say you should try to use in your cleaners, although even one of them, some of them aren't the most ideal ones. Still, just because it's on the list N doesn't mean it's safer. There's other lists that you should be looking at to find safer disinfectants. I think I spent a little extra minute on that. Sorry, let's go on to the next slide and start talking about ventilation. I know this is what you really came here for. Well, in terms of the indoor air quality issue, although I did forget, if you're going to disinfect in a space, you need to ventilate that space too, by the way, because it's not just the virus coming out of somebody's mouth that you need to ventilate for, but if the accumulation of disinfectant, especially if you're using a spray application, which you need to be trained on doing that right, because you might be really exposing yourself and others to the very small particles that are more likely to be react with your airways. But you got to ventilate those spaces out when you're cleaning. Okay, so now I think most of us know why indoor air quality is a concern. I hope most of us are starting to understand why indoor air quality is a concern. We know that the virus is spread by these airborne droplets. We think that it's spread by aerosolized droplets, or aerosolized tiny particles that float in the air. CDC recognized it for a minute and then pretended like they didn't recognize it. The WHO hasn't officially recognized aerosolization, but everybody in the public health community and the industrial hygiene community sees that as the threat, as the way this is being transmitted. And even in a document that did come out from NIOSH and CDC together, they used the term short-range aerosols, which it has aerosols in it. It's good enough for me. I think that we're recognizing that this is an issue. These are not just the droplets that come out of your mouth and fall on the ground. These could, even a short-range aerosol, if it's an aerosol, it doesn't fall to the ground. It's too small. It doesn't obey Stokes' law. It just kind of hangs out in the air. And that means it can hang out for a long time and it can accumulate. In New Jersey, we're recognizing some part of this. The Department of Education says schools must ensure that facilities have adequate ventilation. The only thing is they don't really give any metric or way criteria for us to measure what adequate means. So that's why it's a problem for us, even in New Jersey, to ensure that schools have what they need to properly ventilate. Let's go to the next slide. Thanks, Rebecca. So I'm trying to make this as simple as possible. And this should also be in order about what you should be doing with ventilation controls in order to prevent the transmission of the virus. Number one is exhaust. Most of us don't have a direct exhaust system in our classrooms, that's for sure. We would like to have them in the bathroom. We should have them in the bathroom. It'd be great if it was in the nurse's office. This is a system that just sucks the air out and either goes right out the window, which is unlikely, or through a ductwork and a fan and everything. It goes out and right out the building. It doesn't get recirculated back into the system to be spread back throughout the building again. That's called direct exhaust or dedicated. Well, it's called direct dedicated exhaust. It's dedicated to that one area. Get rid of the bad air. What most HVAC systems are going to do instead, though, is they're going to take the air out and they're going to bring it into what's called an air handling unit that's either on top of the building or on the side of the building, big machine. It's going to take the air from your room, your classroom, back into the air handling unit. It's going to mix it with fresh air, and then it's going to send it back. So that's why we have a supply vent and a return vent for every room. If it's being served, you're more likely to see this in anywhere you do your grocery shopping, or if you work in an office, or you know someone that works in an office, or your local DMV, for example, Department of Motor Vehicles. Most places that you go have an HVAC system with a supply vent and a return vent. And so then that's what's happening. The return air that we've exhaled, which might have viruses in it, it goes back into the air handling unit and gets diluted with fresh air. We can't make it 100% fresh air used for most of the year because it's either too hot or too cold. And in some parts of New Jersey, at least, and many parts of our country, it gets so cold that if you were going to try to put 100% fresh air in the middle of the winter, you would need a heating system like almost as big as the building itself. And so we can't put 100% fresh air, but we want as much as possible because that way we're diluting it. And that's the idea. We're diluting the air. I think about it as a glass of red wine is a really concentrated dose of coronavirus in the air, because there's been people breathing in that classroom all day and some of them might be sick and we wouldn't even know because that's how it works. What we want to do is add water to that glass of wine so that it's no longer red. As much water as possible. That's a dilution ventilation. And even if you have a univent, which I'm not sure, depending if we're talking across the country, there's all kinds of units, but something that might be common is what's called a unit ventilator. It's usually for heating, but it does bring in some fresh air, and it does the same thing. It takes the air from the room, and then it takes the air from outside, right on the other side of the unit vent. There's usually like vents that lead to the outside. It brings in some fresh air and then shoots them out the top over the hot pipes. So that's a similar situation. You're diluting the air. So these can help. We need to make sure they're working, though. And so a lot of people are asking me questions about filters, which is third on the list. And filtration is important, but if the system isn't working in the first place, doesn't matter what kind of filters you have in there. And if people are telling you that it's working and you hold a tissue up to it and it never blows ever, that means that it's not working. You might even hold a tissue and it might blow air, but the damper that's going to the outside might be forced in a closed position, might be stuck. It might have just accidentally closed and it's hard, it doesn't open when you want it to. So you might feel the air coming and think that it's fresh air and it's not. And it might not be you might not have the ability to find out this stuff. And so we need to cooperate with those who are in the facilities department of the schools to make sure that every room that's being occupied, whether it's a classroom, a nurse's office, a bathroom, has the ventilation that it needs. And if, like Rebecca was describing her classrooms earlier, they have no windows, and if they do, they can't be opened. Those classrooms have to have ventilation, mechanical ventilation, and they need to work now, and they need to bring in as much fresh air as possible. And then they should use good filters. If you have a MERV 8 filter, but your system is diluting with lots of fresh air that it's mixing in, that might be okay. But ideally, we would like to have MERV 13 filters or MERV 17, which is a HEPA level filter. The thing is, you can't just put an extra tight filter in a system, because the tighter the filter is, the more the fan is going to have to work to pull the air through it. And if your fan's not strong enough, you can't just turn it up to another dial. It's designed to work within a really narrow range. And so you've got to make sure that the system can handle higher filters if you want to put them in there. Anyway, that's why I put the filter kind of below the first two, which are more important. The last thing is supplement. If you can't do these things, you could supplement with what's called a portable HEPA filter. There's a lot of other terms that are used for it, but it's this kind of thing that it plugs into the wall. It's not built into the building or the room anywhere. It's on wheels and it plugs into the wall. It's got a MERV 17 HEPA filter in it, and it recycles the air from the room, but it's taking all the viral particles out of it. I I'm hesitant to even bring these up because they should only be used to supplement. They don't replace adequate ventilation. They should be supplementing it. So you shouldn't be sticking someone in a closet and then saying, here's the HEPA unit though. I'm saying that this should be added when you say, okay, the system works, it's got decent filters, doesn't bring as much fresh air as we want, but this is a nurse's office or whatever, it's a high risk air for whatever reason you have. We want to put this supplemental filtration in there also. Thing I'll point out about those is, number one, you need to have enough to cover the space. Sometimes they only do like 250 square feet, let's say, with the amount of air changes per hour you want, and your room might be bigger than that, so you might need more than one unit. They need to be powered, so you need to have electricity. It needs to be maybe an extension cord that goes to it, which now you have an extra hazard in the room. It's a trip hazard. But then there's also the possibility that it's really noisy. And, if you're doing asbestos remediation, it doesn't really matter that much. But when you're in a classroom trying to teach in an educational environment, noise, people might be a little more sensitive to it. So that's something else to consider. In terms of standards, if you are working with your district on these things and you want to reference standards, then there's a couple things that I'm listing up here. So the first thing, though, is the ASHRAE standards, and I have to make a point about this. You might have heard this term before about ASHRAE standards. We're using them because they're the only ones that can be used, but they're not for health purposes. ASHRAE standards are, the E at the end stands for engineers. They're an organization well recognized all over the world. They're recognized as being, the authority on ventilation, but they're engineers. They're not industrial hygienists. They're not public health professionals. So their job is to make sure that the machine works properly, not that you're safe in a building. And so that's a really important thing to remember, is that ASHRAE standards for machines, not people. Number two, ASHRAE standards are design standards. They're not operating standards. It means that once the building's been built and the system has been put in place, the ASHRAE standards have no value anymore. They're there to help engineers design the right system for the building. And once that's over, it's done. They're not performance standards. You don't use an ASHRAE standard to measure the performance of the system. As soon as you turn it on, it doesn't fall under ASHRAE standards anymore. It's about putting the right thing in there in the first place. It's all of our jobs, fortunately, to make sure that it's working properly. So the other two standards that I have on the list, though, are health-based standards. New Jersey has a PIOSH was mentioned before by Melissa. It's like an OSHA, but for public employees. And in New Jersey, teachers fall under that. And it's an IAQ standard, indoor air quality standard, and it is health-based. So, we look at that, but we also look at the California Aerosol Transmissible Disease Standards. These are for healthcare workers and for being against tuberculosis. Tuberculosis is even more of an aerosol threat than the coronavirus. And healthcare workers are in a higher risk situation than school workers, but those standards are the most protective that we have for this type of a exposure scenario. And so I just want you to know that they're out there and that you can use them as reference. Let's go on to the next slide. Let's see okay, so I'm trying to give some metrics here to give some idea in case you're already having these discussions. But these numbers are really not for teachers because, again, you're supposed to be a professional educator. You're not supposed to be a professional anything else. And I'm happy that you're here, listening to this and making yourself be a part of this. But again, this is where things start to get technical. And so I just want to mention that this isn't something that you really should know about. All right. But I'm bringing this up here in case folks are already having these conversations. So, and these come from, I'm only using sources here. I'm not, just mentioning things because I think they're a good idea. And for everything that I say here, there's a source where I took this from. So the ASHRAE Epidemic Task Force, I think I just saw that show up in the chat, a link to that. But the links are on these slides to all these things here too. If you click the blue thing that says link, it should hyperlink you to it. You can get this presentation. So the ASHRAE Epidemic Task Force says that if you have mechanical ventilation, you should be taking in 15% of the fresh air or above. Remember when I said you can't bring 100% fresh air in the middle of winter because you can't heat all that air. But you should never go below 15. Some buildings try to put it at 0 and they just recirculate all the air during the winter because it means you don't have to heat as much air. It should never be 0. But in this case, it should never even be below 15, but you should be trying to go even higher than that. Some of these unit ventilators I've seen in buildings, they're not even newer versions of unit ventilators. They've been at 30%. So I've seen some of them that can go that high. Again, I'm not an engineer and I'm not a facilities director either. So these, again, are conversations that you'd want to have with the respective people in your building. But 15% is the minimum. MERV 13 is like the ideal filter. Again, remember, if you tried to put a HEPA filter, which is MERV 17, on your system right now, it's not going to work. There's no way you work in a building that can handle a MERV 17 filter because the building just wasn't designed that way. If you work in a certain ward of a hospital, or maybe, like I say, a factory that fabricates microchips, for example, they have to really get out all the particles. They have MERV 17s. Regular school buildings can't handle that. They might not even be able to handle a MERV 13. But that's the ideal number that ASHRAE is giving us. Then the next one comes from the Harvard School of Public Health, who's doing a lot of work on this, Dr. Joe Allen. And they have a kind of accessible document called the 5-Step Guide to Checking Ventilation. They say that if you don't have mechanical ventilation, which many of us don't, especially if our buildings are from 1910, you should just maximize the outdoor intake to achieve 6 to 12 air changes per hour. So instead of talking about CFMs and percent of fresh air, they're measuring it in air changes per hour. There are ways to measure this by using wind meters, I'll call them, in front of the window. You hold it in front of the window, how much, but that depends on the wind and the direction and the velocity of the wind. And that's natural ventilation. You're relying on nature to provide your engineer. It's not an engineering control then. You're relying on nature, not a machine. But anyway, if that's what you're doing and you feel like you can come up with a measurement, or if you're using an exhaust fan in the window, for example, which is really not an ideal solution, although it is referenced in some CDC guidance, you can really easily measure with an exhaust fan in the window how much air changes you're getting in the room. It's possible. You measure the volume of the room, the CFMs of the fan, put them together, it gives you the air changes per hour. That can give you some idea of how much ventilation you're getting in a space. Another way to measure it is cubic feet per minute, excuse the noise, cubic feet per minute per person, because some of this has to do with how many people are in the room. A really well-ventilated room could be well-ventilated for one person, but then as soon as you put 10 people or 35 people, I heard Rebecca just say at the beginning here, what's adequate might not be adequate for 35 people in the room. This kind of goes to this little thing I have in the bottom right-hand corner here, which is actually maybe a little contentious. Using CO2 to measure the adequacy of the ventilation in the room. I just want to mention quickly how this works and then why this is a little bit contentious. We exhale CO2 all the time, whether we like it or not. It has nothing to do with viruses. We just do it all day anyway. If you want to measure whether or not a room is being ventilated, you stick a person in there for an hour and, well, first you measure the CO2, and if it's at like around 400, which is like what it would kind of be outside, unless it was 100 years ago, it would have been at 300. And in 100 years, hopefully it's not at 500, but it's at 400. You stick a human in that room for an hour, you come back in, it's probably at 800, maybe 1,000. That means the room's not being ventilated. That's how CO2 works. It's a metric that we use. It's a surrogate gas or a proxy gas to measure how good the ventilation is. This is a little bit contentious because what's something that's been happening is a district will get an environmental consultant to come into their building over the summer or when the school is unoccupied, like many of the districts and half of the ones that answered the survey when you're full remote. They go in the building, they measure the CO2, and they say, it's really low. You guys have great ventilation. And you say, but wait a minute, I thought CO2 had to do with people exhaling it. Yeah, so that's why the CO2 thing, if you don't know what you're talking about with the CO2 and how it works, it can actually work against you. You need to be really careful about that. So I'm just mentioning it here because it is brought up in the Harvard School of Public Health document. It's brought up in the New Jersey Indoor Air Quality Standard. They say if it's below 1,000, it's adequate ventilation. Problem is, those are under normal conditions. 1,000 ppm CO2 in a crowded classroom might be good under normal conditions. These are not normal conditions. As a matter of fact, ASHRAE uses a good term. They call it pandemic conditions. These are not normal operating conditions for a building. And therefore, really, nothing that we have applies except for the California ATD standard, which says, because those are similar to pandemic conditions. You're in a hospital with patients that have tuberculosis, not students in a building on a normal day. Okay, so those are two very different exposures, those very different operating conditions for the building. And so they should require different standards. And that's why, again, I remind you that the aerosol transmissible disease standards from California are useful in that context as a reference. And they say 12 air changes per hour in the room in high risk areas is gonna reduce the risk to an acceptable level. I'm not sure what kind of terms we want to use here. I want to remind folks that a building is never safe. Nothing is ever safe. We can make it safer, but it won't be safe. So you can't even ask the district, are our buildings safe? And what we have to really ask is, what is the acceptable level of risk? And has our building been made safe enough to put us below that acceptable level? You know, that's the real question that you want to be asking. You know, how many people need to get sick in order for us to open the building? Just a couple or 100? You know, how many, you know, at what point does, anyway, so what I want to get across here is, you know, we want to do as much as possible in terms of ventilation, but you're never going to make it perfect. And that's why we can talk about these numbers all we want, but you just got to keep in mind that it goes in order. There is exhaust, dilution, filtration, and then supplemental. We can go on to the last slide here. We're going to talk about high risk areas. I just want to make sure that we talk about those. High risk areas are bathrooms due to fecal shedding, which really we don't have enough cases of evidence of it transmitting that way, but there's been viable samples have been taken from aerosolized feces in bathrooms. So that's a high risk area. Nurse's office, obviously high risk area. Isolation room. You got to watch out that you don't cross-contaminate these areas with lower risk areas. And so what I mean by cross-contamination is, if you were to put a tissue under a closed door of a nurse's office or a bathroom, and the tissue goes into the room, that's good. That's what you want. If it blows out of the room, it means the air in the high risk area is now leaving that area and going into the rest of the building. It's like accidentally releasing a virus in the biosafety lab. You want to keep it in the place where it is. You know, it's a high risk area for a reason, like an isolation area. Don't let it come out of there and go into the rest of the building. And that tissue going back one way or the other, that's called negative pressure or positive pressure. And so the high risk areas need to be under negative pressure so that the air doesn't come out of them. All the air in the building is going to technically be going into those rooms and then out. Exhaust fans in bathrooms should be on all the time so that this is happening all the time. So that 5 minutes after I flush and those aerosols are now in the air, but I'm out of the room and I close the door and shut the light off, the fan shouldn't go off. The fan should be on all the time. Isolate potentially infected individuals. I hope that we know that by now. And then follow authoritative guidance I have there, just because there's a bunch of resources at the end here. I see people have been putting them in the chat, but also resources at the end with the names and the links that you can go to. Thanks, Rebecca. And yeah, and that so you have that slide with all the links in it, and then you can go there and click on those if you want to find out more about this. And I'm going to stop it there and let us start taking questions. Hopefully I didn't go too far over.
You're fabulous. We are going to do questions, and I'm going to stop sharing my screen.
Thanks.
And the way we do this is we are going to, I think, maybe take 10 minutes of questions at max. So if you have a question, the way this works is if you are in the Zoom, you're just going to write the word stack. I just gave you an example, and then, look at Matthew. He knows how this works. Matthew, you are on stack. You are welcome to unmute and ask your question.
Okay, I got an easy one. Where do we get this presentation from again, please?
I will give, here's what I'm going to do. I'm going to make a PDF, and I'll give you the sharing version of the Google Slides so you can make a copy. Deal?
Awesome. Thanks so
All right,
much.
hang on. You're welcome. Can someone help me with stack, Yvonne or Katie? Or yeah, Yvonne, could you help me with stack while I make that document?
You're on mute, Yvonne. Just a minute. Okay.
I'm always on mute. That's me.
Looks
Okay.
like-
Oh,
yeah.
we have a bunch of people on stack already. Woohoo! Rebecca Gorelli is the first and best one.
No, that was a model. I was modeling.
Okay.
Go on. Go after
Sorry,
Matthew.
the girl's slow. The girl's slow. Matthew King, can we call on you?
He just went, Yvonne. Go to Kelly.
I'm sorry?
Matthew already went. You're after Matthew. The line
I'm
starts
sorry.
after Matthew.
Kelly,
You're fine.
forgive me.
Okay, hi. Thank you so much for this presentation. It's a lot of technical info and I'm trying to grasp it all, but what I can tell you is that I work on the second floor of a building whose windows don't open. It was built in like 1923. There is air conditioning. I doubt that there's the type of filtration system attached to that you're talking about. So would a portable HEPA filter be enough? And how would I have to circulate air in the room?
Oh, good question. Hold on. I'm taking notes so I can make sure I get to. You mentioned circulate, and I want to mention to everybody, we should not be using fans to circulate the air, because think about this, you're defeating social distancing. Because if, I'm 6 feet away from you and the fan is on, that's going to shoot my particles even further across the room. So be careful about fans for circulation, only for exhaust, maybe, but not for circulation. But you're bringing up a good point, though. Circulation, it is important to consider, because it's like if the air is being exhaust, but as I'm talking, it's passing over someone else's face the whole time and then gets exhausted. Well, for everybody else, that's great, but for the person whose face it passed over, they're being exposed to the whole thing the whole time. Part of where those plastic partitions come into play, but that is an issue. It's the variables are so complex that I can't even get into it. And it would be hard to measure anyway. I'm just going to at least mention it and put it out there for you to keep in mind. You have to have some form of ventilation in your room. If you don't have windows that open, you have to have some form of ventilation. It's possible that the building was went under renovation, and after they put you in a room that now has no ventilation. That's not supposed to be happening. If what I like to say is, if you're in a room with no open windows and no mechanical ventilation, it's not a room, it's a closet. Like when we look at like building plans and stuff, like that's not an occupied space. It's designated as a closet or a mechanical room or whatever. And everything should be ventilated. So this is the time to have those conversations with people that work in facilities. And I would love every building to have kind of like a schedule of every room and what type of ventilation it has in it. Because sometimes there's more than one for each room. So that would be great to kind of get that information from somebody in your building. All that being said, HEPA I don't want to say that it's enough. I like to only say that it can supplement ventilation that's not as good as you want. If you are going to rely on only a HEPA filter, make sure that it's sized appropriately. Or what I mean is you get enough to cover the size of your room. Sometimes a HEPA filter that's this big might only be for a room the size of a bathroom or double the size of that. If you have a classroom, you might need more than one HEPA filter. That's all you're relying on. You're going to need more than that. Next question.
The next one is from the lovely and talented Dawn Wilcox.
Oh my goodness. I'm so grateful for this. You know, I became like a junior industrial hygienist over the summer and was just like looking at everything. So what I came up with, and what first thing I want to say, because I don't want to forget, is it okay for what our school has told us? And that is, if you are alone in a room by yourself and the door is shut, it's okay to take off your mask. Now you've got to understand that would mean there would be like maybe 50 people in the building and one person in each room.
Yeah, I'm assuming that these rooms are being somewhat ventilated. And the idea is you can't infect yourself.
Yeah.
That's how I'll answer. But are people changing rooms? Are you in one room and then when the period changes an hour later, somebody else is in your room?
No, yeah, no.
Then
Yeah.
no. If that's
Okay.
not happening, then okay. You
Yeah.
can't infect yourself.
Yeah. And unfortunately, now that the kids are coming back, you know, their kids are eating in their classroom with their masks off and the poor teachers are having to be in there. So I'm a registered nurse in Dallas at a 100-year-old school. I do have a separate isolation setup. And what I found, and I think works very, very well, is Holmes, HOLMES, makes window fans that are not huge box fans. They just, you know, they go across the entire width of the window, but they're only like half the height of the window. And you can set the fans to either exhaust or intake, which is really nice. I mean, some of them you just have to face them either inside or outside to exhaust or intake. And so in my isolation room, I've put like 3 of those in the windows and I exhaust. If kids are in there, I put it on exhaust, and I have like a HEPA filter, trying to sort of simulate that negative pressure room that we would have access to in a hospital as much as possible.
So I'm gonna respond to that. So this is for other folks too. They should always be going out. If they are, you don't need filters on those. When you said HEPA filter, you mean like a HEPA unit? Okay.
Yeah, unit. I'm sorry. Yeah,
Sorry.
just
I thought you were trying to put a filter on the fan that's going out. I just want to clarify for folks.
Yeah.
No filter necessary. If the fan's just exhausting, then again, what's on the other side of that, by the way? Are kids lining up at the beginning of the day or the end of the day or something right on the other side of that window and we're blowing that air into their face? I just want to mention that real quick. Another thing is always consider your makeup air. So whenever you're exhausting from a room, it's like a balloon that as soon as you start to exhaust, the balloon is going to go in, but it wants to be back out again, and it's going to grab that air from anywhere it can. We want to make sure it's not taking that makeup air from a bathroom or a custodial supply closet that's got chemicals in it, cleaning chemicals. And then last thing, so makeup air. And then last thing I'm going to mention, and you said Dallas, so maybe this isn't really a big deal, but for others, it's going to get cold. And depending on how powerful those fans are, I say more the better right now. But some of those fans that I spec'd a while ago for another school, one fan on its lowest setting was able to deliver 10 air changes per hour to the decent sized classroom. And that's a lot. It might almost be more than it needs. And when it starts to get cold, I don't know if that's going to work the same way. So that's great that you started doing that. I just want to mention those other things for other folks that are listening, because I realize there's people all over here, so climates are going to change. But thank you for bringing up the
Thanks so much.
thing.
Yeah, it is a second floor, and it's the door opens. Obviously it's going to draw air in under the door to a large hallway, so it's not sucking anything in. That's it's going to be some of our most diluted air in the building and from the hallway.
Good.
Right. Yeah.
Up air, then good. Just for everybody else to remind them where it's coming from. Thank you.
I'll put the fan in the chat too, the link.
Thank you.
We have 2 minutes for questions. So I just want to say we might not get to everyone's questions just because we do have some organizing tools we want to get to. But Alan, if you're cool to stay on after 6:30, maybe for like 5 more minutes or something.
Sure.
6:30 my time, Pacific time. So I don't, because I know people are very worried about this, but I want to share the organizing tools because it comes back to, well, what are we going to do about it? Well, there are things you can do about it because I'm doing it in my own kids' district and I want to share with you. So
Yes.
2 more minutes of questions and then let's move through the presentation and come back to questions if that's okay.
Let me take another one.
The next person is the lovely and talented LaRue, and I hope I said that correctly.
You did. Thank you. My name is Veronica, and I'm in Phoenix, Arizona. And my school is right near a major interchange of I-17 and I-10, and it's in a highly industrial area. You leave the building, you smell chemicals all day long. And right near the railroad tracks, I mean, just huge industrial area. Does this inhibit the situation that we could possibly be in even more with
Yes. Okay.
good quality?
Yes. Thank you so much, Veronica, for bringing this up. Really big issue. When I was doing indoor air quality inspections, I did one that was right next to an intersection with I-95. It was about 100 feet away, and the carbon monoxide in the building was like way too high, and it was coming from the highway. It's really hard to filter that stuff out. Let me start off by saying, when we talk about bringing in outdoor air, and one of my colleagues who was doing a similar presentation makes it a point that we're assuming that the air outside is clean and therefore bringing it in is good. You just brought up a case that might not be too different from a lot of other people that are listening, or a lot of schools across the country, where the outside air is actually not safe. It also has its own problems. Opening a window in that case is, you want maximum ventilation for the virus, but now there's this other thing that you're getting even more of. And so we're going to get into this, I guess, with the union talk after this, because, or the organizing talks, because it's, how do you deal with a problem like that? One thing I want to, because what you should say is we can't do it unless we have proper mechanical ventilation. And the reason is because mechanical ventilation, it can at least filter out particulates, which are what comes from exhaust, nitrous oxides, sulfur oxides, all those partially combusted tiny particles that are dangerous to us. That can get pulled out by the filter. Some of the other things, like the odors that you're talking about, filters don't necessarily take that out, and there needs to be other type of filtration. So you can get like a carbon filter, the same one that you put in your water pitcher. That for the air can actually, it kind of bonds with, I'll call them smells. Those are different. They'll go through a filter, but they'll bond with a carbon filter. And, that stuff should be already in operation in your building. I doubt the carbon filter is there, but should definitely only be using mechanical ventilation that can be filtered. Because the outside, and the main point that I want to bring out to folks is, if we're talking about bringing in more fresh air, we're assuming that what's outside is safe, and that might not be the case for you, and it might change the discussion that you have with your district. With that, though, I think is a good segue to move into talking about the organizing and stuff that Rebecca said she wanted to bring up, because that's what you got to start doing when you're in a situation like what Veronica just brought up, because you're stuck between a rock and a hard place there.
Mm-hmm. All right, so I know, and I'm just going to go back to the presentation just so you know what other information is in here, and then we can come back to questions. But I just wanted to share, honestly, these are slides from our last presentation. We had another speaker anyway. So if you're looking for like, I need a slide on filter, like MERV filters, here you go. Our goal is 13 through 15. We know lots of districts, as Alan mentioned, can only run with an 8, right? And you're going to hear that. You're going to ask your questions to your district. They're going to come back and say no. Okay, great. But now I at least know this piece of information. Another piece is relative humidity. So a lot of times teachers, especially I was working in a portable that was very damp, And you think like, I need a dehumidifier, right? But the last speaker, when we had this presentation, talked about how important humidity actually is, because then the water can kind of glom onto the particles and make them drop. So you don't want to suck out all the humidity, because that's not what you want. So you got to watch out for the humidity. 40 to 60% is the target. Now, I'm not saying you're supposed to know this as a teacher, but you can sure as heck ask some questions. And as Alan mentioned, and this is the steps I went through with my own kids' district, is, okay, I want to know what the filter is. You're telling me it's at this level. Well, I now know that if I've asked about filtration and I've asked about all those other things Alan talked about on the list, what about supplementation? What about HEPA portable filtration units? And will you as a district fund those? And I got laughed at the first time around. It took me 5 emails to actually get somewhere. So another really good graphic I found in Alan's document, the Harvard put out this risk reduction strategies for reopening schools, and it's just a flow chart. In Arizona, we don't have open windows. That doesn't exist very much. So we follow this. And if our district says they can't put in a 13 or greater, it shows that you should then supplement. And so, Alan, I hope this is the right thing. This is the new stuff we've added to this presentation, and that I've used to argue in my own kids' district in favor of purchasing these HEPA filtration units for every classroom, and to get teachers to be reimbursed for the ones they bought out of their own pockets, because that's ridiculous. So again, we just want to put a slide in here to remind you about isolated spaces. So remember, you know how districts and schools dump kids. You know this. They put kids in different places. You need to be watching out. If you see something that is not right with where they are putting these kids, you need to speak up about these isolation rooms. So we just want to put that out there. Now this, I'm fortunate enough to be a member of the Council of State Science Supervisors through my science work in my career. And I went to this webinar with the Council of State Science Supervisors, and starting at minute 16, it talks about all things from a science classroom lens. So if you're a lab teacher, a STEM teacher, thinking about chemicals, plexiglass, and how you don't want chemicals glomming onto the plexiglass, really good information, including this graphic. This graphic shows up at 20 minutes. And what they describe is something that an organizer in Arizona, I've been asked this question many, many, many times. Rebecca, how do we know how many kids should be in a classroom? And it's all right, get out your graph paper, draw a rectangle, apply this circular radial idea to your graph paper, and figure out what your max capacity should be for your space. And so if you're wondering how to do this and you're not a super math person, watch this video. He will explain it. It's literally putting a person as the center of the circle, 3-foot radii on both sides, and measuring 6 feet from the dots. And so you can just do this on graph paper, and you can arm yourself with a way to fight back and say, I should not have 30 kids in this room. Absolutely not. Here's my evidence. So if you're looking for that, go in this webinar. It is in there. And then finally, I want you to think, because as an organizer, I get very, very random questions from people all across the state, and it happens very frequently. And I know my colleagues feel this as well. As people who have put ourselves out there as risk takers and organizers, we tend to be the people go to. And you ask yourself, is your district, is your school organized to fight back? Just think about it. Do you have a way, an organization to fight back against this poor ventilation? 8 times out of 10, the answer is no, they're not. And people don't know where to start. And so I just want to explain kind of where I started with organizing around ventilation in my own kids' district, because this is my hill to die on, quite frankly. I'm not putting my kids back. I'm just not. And so when you think of how the boss structures workplaces, it's top down, very top down. And can everyone just make sure they're on mute, because I'm having trouble figuring out who it is. And so everything comes top down. But if you look at this picture, where are there more of us? It's the rank and file. Look at how many dots of us there are versus them. And if we can find a way to connect to one another, find issues that are widely and deeply felt, and figure out structures to build power, you can fight back against this very easily. The problem is no one's speaking up because of fear of retaliation. So how do we fight the fear of retaliation? How do we fight apathy? How do we get through the mold? Well, we can organize ourselves. And this comes from Labor Notes, the people who wrote Secrets of a Successful Organizer. This is my go-to on how I organize everything we do. And I put it right here. And really, it starts with having conversations. 9 times out of 10, I hear teachers go, well, I feel alone. I don't know who's with me. Well, have you spent the time opening up a Zoom room or a Google Meets and talking to people and invite them into the space so you can start to figure out who your people are? So step 1 is having conversations with others that you trust. Then if you can find some leaders, identify those leaders. Who will the district listen to? Who will the principal listen to? Are they good at their job? Are they people that someone trusts? Find some leaders. And then those leaders can then bring in other people and build a committee to fight back. It's really that simple. But if we're not opening up a space like we did tonight with a Zoom link, the space won't exist and those conversations won't happen. That is step 1, open a space. When we organize, those of you who are in Arizona and you remember our liaison network, we literally followed this model for the Red for Ed strike wave. This is how we built power in our schools. We had over 2,000 volunteers to organize over 1,200 schools back then. And this was the model. In every single school, there needs to be a committee of people who are going to do the work. If no one's willing to do it, nothing's going to change. And so if you're wondering, like, how do I get started? Well, here's a 1-pager from Labor Notes to talk you through this. The first step is to talk to your coworkers. Your job is to find issues that are widely and deeply felt, meaning what are people going to actually care about and what's going to move them to action? Next is you have to collect information. Building lists is part of organizing. If you don't have lists, you can't get people involved. So start a Google form. Share it throughout your school, collect people's information, bring people together. This was our best strategy with our liaisons back in 2018. We called them 10-minute meetings. Get together, talk about things, short agenda, get moving. And then after that, you start to make demands. And so in my own kids' district, I've been talking to parents. We formed a group. We started meeting on Sundays. I've already done this work. I've taken the charge on ventilation because as a science person, this is the biggest variable fighting us right now is ventilation. Nobody should be in schools right now. It's ridiculous. And so what I did is I took all of this information, I researched it, I wrote my board 5 different times. They literally laughed at me the first time, tried to combat me with evidence, and I kept coming back. I wrote the board 5 times. Then I showed up in person, got a bunch of people to come with, and I talked and made a public comment at the governing board meeting. That was less than 2 weeks ago. My next step is I built this petition. So if you're looking for a petition around purchasing HEPA units for classrooms, I also asked the district, there's a bunch of questions in here that I wanted answers. Where are the maintenance documents? Where are the building inspection documents? What MERV filters does every school have? I want to know about CO2. I want to know about volatile compounds, air exchanges. I put all these things in there. And then we asked for them to purchase these. We now have heard this district is going to try to team up with the city to buy these for $1.5 million. A conversation that was not happening 2 months ago, but because we said something over and over and over and over and over, look at what's happening. Now they're talking about it. It actually exists. So there's a petition I wrote. If you would like to look at it, use it, go ahead and steal it. We just released it yesterday. And these are the questions and things I put in my petition. If you're wondering, I got these basically from doing research with people like Allen and other people. And then there's a New Jersey toolkit with actions around ventilation. If you're wondering what kind of actions can you take. So we just wanted to give you some sample tools of what you can do to organize in your area. But if you think it's unsafe, there is no way change will happen unless you do the work. And I'm going to tell you, if your union is not doing it and you're waiting on your local, you're going to be waiting a long time. Organize outside your union if you have to. It's okay. That is a space that anybody can occupy. I organized as a parent and I got parents involved. You do not have to wait for the union. And if your union does not think this is serious, then perhaps it's time to organize outside of the union, is all I'm saying. And if you don't have a union, build your own bona fide outside the union kind of thing. That's what we did in Arizona in 2018. And so we don't have to do the jam board. That was just going to be closing, but I wanted to give you some organizing tools in your back pocket, show you kind of what I've been up to on a personal level, and that's it. So those things are in there, and we also all the resources I use to build my petition, and that's it. So Alan is open for questions, and we'll come back.
I see. I see one already that came in. I just want to start real quick and talk about this because I didn't talk about it before. Someone's asking about purging. And it's a word that I meant to bring up before I did it. Purging is the idea of when the day is over, you leave the system on, but ideally you turn it up even more so that even more fresh air is coming in. And the idea is that if the building is not under normal operating conditions, it's okay if the temperature goes down a little bit below 68, 70 degrees or above. And that means so you can bring in even more fresh air than you normally would without having to worry about people not being comfortable. I see somebody asking, is it okay if my building is purging during the day? Does it mean that, it's better? It's good that they're doing it because it means that they know about that extra control. When you say during the day, I'm not sure if it's in the middle of the day. That would be great, actually. Usually purging only happens at the end of the day. And again, the reason is because if you up the amount of fresh air that you're bringing in, then that means that you're also going to be making it colder or hotter. And so there's usually not people in the building while you're doing it. If they're purging while you're in there, that would be good. But again, no one thing is enough. The hierarchy of controls has a bunch of things. We need to use all of them. And even within ventilation, there needs to be a bunch of different things that are used. That's why we say filters, dilution, exhaust. Purging is another thing, but by itself is not going to be enough. We got to make sure that the systems themselves actually work. And that's really hard for us to figure out because HVAC systems don't work on the whole building. They tend to be spread out, and every classroom might have a different one. Make sure they work, number one. But purging is good. I'll let Yvonne continue with the picking question.
Thank you. And forgive me for having my incredibly unhealthy dinner in front of everyone. It's 9:30 here on the
Right.
East Coast.
Yes.
And I was just like, my husband was good enough to bring me something to eat. Our next person, I believe, is the lovely and talented Kelly Fisher. Had a question.
Oh, that was the question that I just answered, I think. Kelly.
Okay.
And
Okay.
somebody mentioned, don't most facilities turn off the HVAC at night? Yeah, they do. Purging only needs to happen. The guidance uses the metric of 2 hours. But really it depends on how high they upped the fresh air percentage. If they put it like to 100%, then you could do it for X amount of hours. But then if they only do it for 50%, then maybe you want to do it for double the amount of hours. Some are being asked to do them 24 hours to ventilate, just keep it on for 24 hours. So they might be doing that in your building too. That's all going to depend on what the climate outside is like though. So thanks. All right, next. What's our
Next person is Gabby Mitchell.
Thank you. I think you sort of covered the first question that I had, which was about if, like, I was just on, my district is having their board meeting right now, so I'm doing two things. But they mentioned that they ordered, because of demand, they're not able to get the 13s, so they ordered 11s, MERV 11s. And so then you would just supplement with the purifying, and they ordered those. But again, those they said might be, on back order due to demand. And so that's what we're working with right now. The other thing that I had was a parent that came on, and she was talking about how the elementary, those settings will work out. They're bringing in a cohort A and a cohort B. But here's the thing that I have about this is that, okay, so once the kids with the cohort A go home at noontime, then they're going to have to go on a bus. And well, this HEPA thing doesn't have anything to do with that. But there's the other problem that I see is the busing.
Right. Okay. So I'll start with the busing and then go to the back order. Again, remember about risk equals duration times exposure, duration times intensity. So buses, kids are probably not just sitting on a bus quietly, right? I mean, I don't know, my image of a bus, I was a teacher for a very long time, but I didn't spend a lot of time on buses, but my image of a bus is kids like acting crazy and yelling. And if that's what's really happening on a bus, then the intensity is a little higher. If it's not, because they're all being well behaved, the intensity is lower. But then duration is a question. And I'm speaking to folks all across the country. I know that, here where I live in New Jersey, you're probably on the bus for 15 or 20 minutes. But even in New Jersey and some other areas, you could be on the bus for an hour. In some other parts of our country, you might be on the bus for an hour. So keep in mind what your risk is based on intensity and duration. And then the other thing is with buses, we can't usually, on an older bus at least, you can open windows on a bus. And if the bus is moving, it's kind of like having a fan in a way, because the pressure that's on the outside of the bus is so much higher than the pressure on the inside of the bus. That's kind of what a fan is doing. We don't really think of it like that, but that's what a fan is doing. So it's, in a way, it's like every window has a fan in it. The direction is important, because where the air comes in and then where it goes out might put some people in the exposure path of others. But again, duration and intensity are the two things to first consider when it comes to busing. The other thing is about back orders, and I just want to mention this is part of like your organizing part of things, is when you go to your district and say, we want these extra things, and they say, sure, you got them. You don't have them yet, because everybody in the world is looking for a HEPA unit right now. Don't forget that. So if you didn't start asking for them 4 months ago and you started asking for them yesterday, don't let them tell you that, okay, we got it, problem solved. It's not over until you see those things in the room itself. Oh, it's coming. We saw it on the text that said it's on its way. When it's in the room, you got it. So I just want to put that behind like the organizing part of things, like stay on, if you can actually get someone to commit to this, stay on them until they get there, whatever it is, whether it's a HEPA unit or whatever. Next question, Yvonne.
Thank you, Ellen.
Thank you.
Sorry.
Thank you for
The
bringing that up.
lovely and talented Kylie Walzak, and I hope I said that correctly.
Yvonne, that was perfect. Thanks. Hi, I'm Kylie, calling from Tucson or watching from Tucson, and I'm a parent. I'm a former teacher. I want to just like let you all know about a couple conversations that I'm hearing in parent circles. And the parent circles that I am hearing conversations happen in are not representative of the majority of the TUSD students that I think go to TUSD. These are a lot of first responders, medical care providers, doctors, nurses that are saying the transmission rate, and I'm sorry if you covered this, I was doing a lot of other things for the first part, but the transmission rate amongst young children, so we're talking kindergarten to fifth grade, is really low. People are saying this as if it's a fact and they can measure it. Therefore, it makes sense to start letting elementary and younger kids into schools sooner and at higher concentrations. I want to just ask your comment about that. And I know you're not a medical expert. The other thing is, I watch my kids kinder Zoom every day, all day, and I can see there's this slow transition into the classroom. Sorry, Rebecca, you talked about this last time. That there's already teachers in the classroom preparing the classrooms for an eventual transition to hybrid that are already like not wearing their masks properly. And I want to know from all the organizers on here how to have conversations about this with the teachers now. And also, oh, one last thing, sorry. And one last thing, a request from Rebecca and other organizers is, can we get some sort of like spreadsheet with like the questions that we should be asking of our specific sites, where my kid goes to school, that is like, what is the age of the building? What is the ventilation of the building? What is the type of unit that you all have? So that, you know, if nobody at my school is asking these questions, and I hope some people are, but I would love to start that conversation.
So can I just jump in real quick?
Yeah,
So in
yeah.
my petition, you can see what I've asked. My kids are in the East Valley. You can see what we asked there. And as far as the little kid argument, in our last town hall, we talked about pre-K, kindergarten. I'm sure Alan could go in, but I just wanted to tell you the summary from our last conversation was it's about viral load. And because little kids don't project as far as adults with so much force, that's why the viral load, this is where the argument comes from. This is what our other speaker who works on buildings as well was talking about. So I just wanted to put that out there. But as far as questions, like I'm not saying I won't build the question thing, but it's in my petition. So you can see what I've asked. And in this slide deck, we do have some lists of questions. So use that as a starting point and then add to it. And then the point is you need to organize. If you're the only one doing this by yourself, like I was over a month ago, you ain't getting nowhere. You're nothing's going to happen. So that's why I started organizing parents and holding Zoom calls on Sundays. And because if I go in there alone, I'm just this crazy science educator who loves science, right? Instead of, no, I'm here now with a whole bunch of other people that believe in what I believe. And so it takes work. This has been me going after my governing board now for over a month. And now I've escalated. I'm organizing. We're showing up at board meetings. That's escalation, right? It's a natural organizing process. And now it's petition. What comes after the petition is I'm going to deliver the signatures in person and then see what the response is. And then again, keep escalating and keep escalating. And speaking of Arizona Educators United, we are going to host an organizing training soon. It's just ventilation needs to get done now, and then we'll do that next.
And then
Ellen?
I will clarify, let me clarify something here about the 12-year-olds. Interesting that you just brought it up now, because the CDC, who began releasing again their MMRWs, just this kind of like national public health report, which they stopped releasing for like the majority of the pandemic. I think this is one of the first ones that came back out. And what they're showing is that children under 12 are having less, let's say that the symptoms are less severe. Which kind of is what you would think, because of COVID-19 is an overactive immune response. And when you're under 12, you're more likely to be working off of your innate immune system and not your adaptive immune system, the one that like has a memory and develops antibodies and stuff. The important thing to remember about that is, okay, kids under 12, and I'm not raising my voice to, you know, like yell back at Kylie, because it's a good point, and I'm glad you brought it up, because this is going to become a bigger part of the national conversation coming up. This population of students are less likely to have severe response to the virus. What we don't know is whether or not they're less likely to spread it to others. And the reason that I say that is because I'm here on behalf of educators. I was an educator myself. I care about students. I care about public education. I just devoted my whole life to that prior to this. And now I devote it to the educators themselves. They're still at risk. So like, okay, you say like the risk of the kid is a little bit less because if they're under 12, not to mention the educational risk of them not being in school is greater versus a high school student. So like the balance starts to change, and I get it. But let's not forget that it's not about the risk to students. And that's what the whole conversation is going to be nationally. And that's why I'm glad that Kylie brought this up, because I want to make sure that folks remember this isn't just about the kids. This is about the workers too. And I saw somebody say something in the chat before about like first responders going back to work and stuff. Why can't teachers go back to work? It's not what teachers do. Teachers educate. They don't like put themselves in the line of danger and stuff like that. It's, you know, it's not what you signed up for. And so, so I just wanted to mention, I'm glad that Kylie brought that up, and that, you know, remember that point that, like, yeah, they might be less susceptible to severe responses to the virus, but it doesn't mean they're any less likely to transmit it to the workers that are exposed to them. And so just kind of keep that in the back of your head as this conversation kind of develops over the next few months, as it will, definitely.
And one more thing, because I've gotten that same argument nationally, and I was interviewed about my comment in, I don't remember what paper, Time Magazine or Intercept or something, but what I said is no other profession is asked to be in a tiny space with poor ventilation with 30 plus people. The grocery store argument goes out the window, hospital argument goes out the window. Show us an actual comparable apples to apples comparison. There is none. That's a moot point. It's a ridiculous argument. There is no comparison for 34 kids in a room where I'm not allowed to open the door and I'm there for 7 hours a day. No comparison. That argument shouldn't even exist.
Yeah, thanks. Yeah, it's, you know, I'll leave it at that. That's a good point.
It's ridiculous. We can't allow the narrative to keep, no. So it is getting
context.
Yeah, I mean, I don't even think people realize that, especially in Arizona, we have 34 kids in the class or more. You know what I mean? Like, so anyway, it's getting late. Is there, Yvonne, where do you think we are we good? Did we answer most questions?
There were two related questions that we might want to sneak in, and they were about actually configurations of students.
Oh.
One person was thinking that perhaps they should be 3 feet sideways, but bigger than 6 behind. And another person was thinking, should the seating, you know, right now we're on rows and columns. Should it be staggered? So you've got 4, 5, and 4, 5. So nobody's directly behind anybody. Were the two different configuration questions.
Yeah, there are, you know, those are the parts of the guidance documents that I don't spend as much attention on, but I remember seeing, and it might have been the New Jersey Department of Education, but there's a few states out there that, like, in their kind of like reopening guidance documents, they've got pictures and like pages of charts describing the different configurations and which ones would be better. And I can't off the top of my head remember which ones. You could double check the New Jersey Department of Education. Also, when they look at, like, when they talk about how to put people on buses, they're using the same diagrams. And the bottom line is what that person, I saw that question in the chat, what that person is bringing up is a good point. And yes, that is what we would want to do. The same way that we try to stagger schedules of people so they're not all there at the same time, we try to stagger spatially people not in line with each other. Then again, the other side of that, though, is who knows how the airflow is going to be going in the room. If you got a supply vent on the top over here and the return is over there and some kids are over here, who knows which way the air is going to flow, and that's what makes it a little bit more difficult. But for the most part, you should be trying to stagger people around the room. Thanks, Yvonne. Well, that was good. I'm glad we got to the end of the questions there.
I think that's everything. I could be wrong.
All right. Well, Alan, honestly, we can't thank you enough. You've kind of been our support mechanism for a while now, so thank you.
Well, no, I have to say thanks to everybody here for coming, first of all, and then to all this information about organizing, because what I'm saying really doesn't do anything if you then can't do anything with it. And that's why I think what you guys are doing is even way more important, because you're going to allow folks to do something with this information. So thank you for putting this together and for your commitment to this too.
That feeling is mutual. Thank you for your commitment to helping us understand the science. So again, thank you all for coming and being here. Thanks to my colleagues for helping put this together. Alan, we owe you big time. we're going to keep fighting, and we're going to use your knowledge to give us confidence. So thank you for uplifting this struggle for us, and everyone on here, thank you for being here. And we are hoping to host an organizing training. So if you're like, man, I really want to organize, I'm not sure how to do it, I got some tools. And we collectively, National Educators United, have a lot of us organizing in different places. It's just a matter of smushing it into a training for you. So we will get there. So thank you all. And I think that's it. Have a good night. Alan, thanks again.
Night, everybody. Thank you. I just want to say thanks again. Have a good night, everybody.
I appreciate you.
Thank you so much. It was
You're
great.
amazing.